Good morning, everyone. How's everyone doing? This is Kenji here again. I actually just left the hospital. I had to do a dressing change for my pit line right here. So every week, they have to change the dressing just to make sure that there's no infection. So yeah, it's just another medical appointment, I need to keep up with, on top of the chemo infusion every other week. And man, just so many appointments to attend to, right? And actually today, I had to do the blood draw as well through my PIC line. So yeah, before every infusion, they have to do the lab to make sure my blood work shows, I guess they are like shows that I'm like ready, I'm okay to do the another infusion. So yeah, hopefully this blood work will show that I'll be ready to do the infusion. So yeah, some updates, guys. I saw after the CT scan result, I met with my oncologist. I was done with my 6th cycle, as you guys know, and after my 6th cycle, they did the CT scan to make sure, or to check if how those lung nodules are responding to the chemo treatment I was doing. So I was on this chemo treatment called 5FU plus irinotecan. And yeah, the doctor told me that it's a good sign that these lung nodules are responding, they are shrinking. So all of the lung nodules, they have shrunk by 2 to 3 millimeters on average. And honestly, yeah, it's when she told me it's a good sign, I was kind of relieved. But then was not so good still was that she was like, so I thought it was going to be my last chemo, and she was going to have me do another treatment, maybe radiation or surgery or ablation procedures. But it did not turn out to be the case. So she told me that she wants me to continue the chemo treatment for now because they're responding well, and she is going to have a tumor board meeting with other doctors, right? So including radiation doctors, interventional radiologists, and she is going to present my case to the board and see what kind of follow-up treatment they recommend. And she told me in the meanwhile, she has to still put me on more chemo treatments because she does not want those cancerous lung nodules to grow back, which does make sense. But then, I don't know, I was thinking, okay, if that was the case, why didn't you, I don't know, why did you tell me it was gonna be my last chemo? Right? I really had high hopes that it was going to be my last chemo. I definitely did not see it coming, right? So I definitely was I don't know, I had such a mixed feelings during the appointment. And I was like, okay, well, the thing is that the nausea has been so brutal, I told the doctor. And, every time I go on the infusion, I really, really question how much longer I can keep up with this. Because it's so hard, it's been so brutal. And, she has tried all kinds of anti-nausea meds, And I've also met with a palliative care doctor as well, because she's pretty much run out of the ideas of how to like address the nausea. And I'm not sure if she completely understands how bad it is when I tell her it's really, really bad. But anyways, I told her, like, doctor, is there anything else you can do? Because I mean, I'm not opposed to chemo. Like, if it's helping, I really, really want to continue. But the side effects are what's really, really killing me right now, and what's really, really making it more and more challenging every time I do it. And every time I go on it, I really, really think about, I really want to stop. Which, when I don't want to stop, I really want to stop because of the nausea. And she was like, okay, like maybe irinotecan is the one that's causing so much nausea that's not controllable. And I'm going to try to reduce the dosage with irinotecan, right? So yeah, the following treatments, I think she's going to put me with infusion with less dosage on one of the chemo drugs, and hopefully, the nausea is not going to be as bad, right? And she said, like, even if she may reduce the dose, effectiveness of the drug might still be the same, right? So we'll see. But really, if she's going to be put me on like a long-term chemo treatment, I feel like there has to be some change, because it's just so intolerable. Anyways, that's it for the updates. Again, I was pretty disappointed, obviously. Even I would think I was devastated when she said recommend more chemo. But what can I even do? Like, I don't feel like I should say no, right? If the drug is working, I should probably continue with it. At least, for the time being, because she has to meet with their other doctors to see what other treatment options they're going to recommend next. So that's it for the updates. And after I met with the doctor, again, I've been praying so hard. I've started like picking up the Bible and reading Bible verses and praying every day. I grew up in a Christian family, and after my cancer diagnosis, I guess my family's really, really coming together to make sure that, I don't know, I go back to Jesus Christ and I start believing in God. I've never really taken God or Christianity seriously before. But what can you even do, like, when you are in a desperate situation? You become desperate and you start to look for God. I'm very, very afraid of death. I'm very, very afraid of pain. I'm very afraid of like how much time I may have left. And every day I struggle with crippling anxiety, and every day I deal with existential thoughts, my own thinking about my mortality. And these intrusive thoughts are really, really what's haunting me, what's really affecting quality of my life as well, not just the chemo, right? So during the chemo infusion week, am like I'm riddled with the nausea. But even after, like, not like the infusion week passes and my body starts to feel okay again, I'm still like just filled, my brain is filled with all these intrusive thoughts, right? And it's so uncomfortable to have these thoughts, intrusive thoughts, just come, and it really bothers me, right? It makes me really anxious, and it depresses me to no end. And I really don't know what to do. And I know that you guys recommend, like, Kenji, stop thinking about your death, we're all gonna die. We really don't, no one is like guaranteed tomorrow, and I completely, like, logically it does make sense. But then emotionally, it just I can't seem to be able to let go of those thoughts and those depressive emotions. For example, okay, let me give you an example. Like, okay, don't think about a pink elephant, right? If I tell you to not think about a pink elephant, close your eyes, do not think about a pink elephant. What do? You think about a pink elephant, right? So our thoughts, our feelings often do not follow what our mind tells it to do. It just doesn't. It just not how our brain is wired. So no matter how hard your mind tells you to have like to think a certain way, it doesn't matter. It doesn't matter how hard you try. Your thoughts is going to just have its own thoughts. It's just gonna do its own thing, right? So I don't know. I've been like praying really hard. I've been trying to distract myself, but these intrusive thoughts just pop up in my head. And I really, and I don't try to entertain those thoughts. But when it comes, it's just so hard for it to leave my brain. So again, yeah, it really does affect the quality of my life. It really bothers me. So I try to focus on my work. I try to do other things, go out and whatnot to kind of help myself to distract my mind, my thoughts. But more often than not, it just doesn't work. It doesn't help. So what I did was, since I've been so depressed and so anxious, like every day I have like these anxiety, like little anxiety attacks here and there, and it's been just as brutal as the nausea, so I remembered how ketamine therapy could be helpful. I don't know like how many of you are familiar with it, but basically it's like a drug that induces you to kind of go on a trip, right? Like kind of hallucinate almost, right? But apparently, yeah, so it like kind of makes you to dissociate, and studies after studies have actually shown to help those people with chronic depression, chronic anxiety, chronic addiction issues. And yeah, it's been proven to be very, very helpful. And I remember reading a study about how, people with long time addiction to alcohol, like 20, 30 years of alcohol addiction, they did a study on those people, and even after like one or two sessions of ketamine treatment, I think 70 or 80%, if not higher, of them quit alcohol. They stopped drinking completely. And a lot of them actually have tried, in the past to quit alcohol, and they just couldn't, right? That's why it's called like chronic alcoholism, because it's been just lasting just for such a long time. And they just could not quit alcohol, right? I mean, alcohol is like one of the drugs that's very, very hard to quit. But after they had gone on like couple of sessions with ketamine treatment, yeah, they were able to quit. They were able to stop drinking. I mean, how is that even possible, right? It sounds very like too good to be true, but actually that's what a lot of these studies have been shown to work. But it was saying how you need like these people that were able to have the full benefit from ketamine. needed to have a mystical experience, need to experience like these I guess your consciousness has to like go out, or like has to be altered, right, in some way with these mystic experiences. So yeah, you go on a little trip, and somehow, I don't know if you meet God, or you go out of like your body, or your mind goes out of your own consciousness, but you have these like unique experiences that just works. So I remember that study. So yeah, I looked up online, and apparently there's like this online program where they send you like ketamine, and you take it on your own, and you meet with their therapist, put their doctor, and they kind of like monitor, or you consult with them, and it's supposed to help. So I think I might try that in a couple of weeks, because just guys, it's just this crippling anxiety is just really eating my life away. I feel like even the little, I mean, I may have a year left, maybe 5 years left, 10 years left, who knows, but I feel like unless I address this crippling anxiety rest of my life, it's just going to be I'll be like suffering with anxiety for the rest of my life, and I don't want that, right? I really want to spend this limited time on earth, as meaningfully as possible. I don't want to spend the rest of my life in a crippling anxiety, in a crippling depression. And again, I feel like I just need to try, every help out there, right? So I've been going to peer support group, support group for cancer patients. I've been, praying to God. I've been reading a Bible. I mean, I think I'm trying everything I can, and I want to, if there's more things I can try, I want to try that. I just want any help I can get at this point. But then again, I just don't want this, I don't want to let this anxiety eat my life away, eat my soul away. I feel like my soul is slowly and painfully dying, right? So I don't want to continue this. So that's the update, I guess, in terms of seeking more treatment. And if you guys have watched up to this point, again, thank you so much, and I'll see you in the next one. All right, take care, guys.